Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
Okay, my name's Kevin Williams. I'm 54. I'll be 55 November the 5th, Bonfire Day, this year, 2012. I was born 1957 in Cornwall, little fishing village called Flushing. My father was a farmer. He farmed all the land above the cliffs. Unfortunately, when I was 3, he drowned in the sea. My mother remarried to a businessman. His business was in Leicester, so I moved up to Leicester. I have 4 sisters and a brother. One of my sisters is my twin. There's Janet, Misha, Janet, Odette, and my brother's called Malcolm. I did my schooling in County Sort College. Then I went to university and did a civil engineering degree, left university and joined what was British Rail and did an under management trainee course with them and worked my way up to be the chief civil engineer for the London Midland line, which goes from Sheffield, Leicester to London St Pancras. Met a girl at a nightclub in Leicester, the Pally, that used to exist. We got married, moved out to Thurmiston. We had our first child, he's called Ben. He's now 28. Then we moved to Sileby, and we had our second child. And then we moved to Rowfleet, well, near Rowfleet. We loved it there. Basically, the family grew up there. I grew up there, developing as a father. We had a great time. I was doing really well with my job, very successful. We had a good life. We could afford to go abroad and things like that, but I had to work hard for it. And everything was going fine. I had my 40th birthday, which suddenly seemed to come around, but that's life. And then I suddenly started to feel not very well. Kept getting back pains and decided I needed to go to my local GP surgery, which is just round the corner. So I went round there and I kept going back and forwards about 8 or 9 times, and they just prescribed different tablets to try and take the pain away. And then I noticed I started to get bruises on my legs, but I just thought maybe I'd moved over in the bed and, I don't know, knocked something or whatever. So I didn't take much notice of that. But as time went on, the pain was getting worse. And it got to a point where I said to the doctor, you know, I don't think it's just back pain. But my GP, is a female, she said, have you recently got a new car? And I had got a new car. And she says, it's probably your seating position. I thought about it, and then I thought, maybe that's quite logical, really, because it was a different style of seating, but it just carried on and carried on. And I ended up going back to the GPs, and this particular day I went back there was a different doctor who I saw, and he'd gone through my notes, and he said to me, this is really strange, Kevin, because you've lived here for about 10 years, and we've never seen you. The first time we saw you was when you registered yourself, and then we've not seen you for 9 years, basically. And now we've seen you 8 or 9 times. I think we need to do an X-ray and a blood test. So that's what I had done. We won't have the results for 2 weeks. So I carried on with my normal life, working, bringing up the children and things for 2 weeks. Obviously, in my mind, I wanted to find out what the results were. So when it came to basically the day that I could ring up or go round, I had to go to London. So when I was in London, I was running really late. And so I rang my wife up and asked her if she could ring and find out the details. So she did, but obviously they wouldn't give any information on the phone. So luckily I managed to get back before the surgery closed, and I went round and went into the doctor's room and sat there and, right, Mr. Williams, your x-rays are fine, there's not a problem with your x-rays, what we can see. But there is a problem with your blood results. We think you've got cancer. And that's exactly how it came out. We think you've got cancer. As soon as she said the word cancer, I never heard another word. She carried on talking, but I haven't got a clue what she said to me. So I just stood up and went home, walked in the kitchen, and my wife was doing the normal thing that a wife does, getting the meal ready and everything. And she said, what did she say then? And I said, well, the x-rays are fine, but she mentioned the word cancer. And obviously my wife stopped straight away. She was looking at the cooker at the time, and she stopped and turned around and said, what do you mean cancer? I said, I don't know, Kath. I can't remember. So she got straight on the phone and managed to talk to the GP, and she said, come round tomorrow first thing, which we did. And my wife came with me just so she could listen in detail. So anyway, the doctor then said, look, we think it's something called multiple myeloma. It's a type of leukemia. What we need to do to confirm it is for you to have another blood test. So they arranged for me to go to Loughborough Hospital within a day, and I had the blood test, but it was going to take over a week to get the results back. Now, at this time, I'd actually got an office at home, and I remember doing some emails and things on my computer, and as I was working away, something inside my brain says, it is cancer, Kevin. You've got cancer. Deep down I knew I had. No one had actually confirmed it, but that's how I felt at that point. And then I was doing the same kind of thing as this. I was making a corporate railway video on the Great Central Line, which is a steam railway, to promote something, and I was in real bad pain, and I had to say to the film crew, look, I'm going to have to stop. I need to go home because I didn't live too far away from there to get some painkillers. So we stopped filming and I went home, and my wife was in the kitchen doing a normal wife thing. A friend was round and they were having coffee, chatting, you know, in the afternoon. Anyway, suddenly the phone rings and it's the doctor, and she said, I need to come round straight away. So she came round and she says, you need to sit down, Mr. Williams. And so I sat down, and obviously my wife sat down as well. And she said, look, it's been confirmed, it's multiple myeloma. You need to go to hospital. And I says, hospital? Yeah, you need to go to hospital. I said, when do I have to go to hospital? There's a bed ready for you. And I can't go to hospital now. I've got a film crew, and, you know, what about my sons? And you've got to go now, Mr. Williams. So we went to the hospital. We went to the Osborne building, 2nd floor, and they took me to one of the side rooms. I think it's probably the way they do things, because they're going to talk things through about the cancer. But suddenly I was sitting on a chair, and suddenly I developed panic attacks. I couldn't breathe. I was overly stressed, I suppose, and I couldn't get my breath, and my wife was panicking, and she called the nurse and she came in and calmed me down. Anyway, from that point, that's where everything started.
I'll say for the viewers that Kevin's here to tell us a bit about his life's journey around the myeloma, really. Myeloma is one of those cancers that people don't necessarily know a lot about. It's one of the more unusual hematological cancers. Do you feel that, having gone through that process and lived with it for some time, do you feel you now know a fair amount about that condition, or are you still really looking for information about it?
Well, no, okay. You actually don't know anything about cancers, really. Most people don't know. They know the word cancer. They know you can get breast cancers and things like that, but they don't really know much about cancers. All you know is the word cancer, and you either live or you die, and you have to have chemotherapy. But I wasn't actually told in detail what multiple myeloma is about, other than it attacks your bone marrow. Your bone marrow's all around your body. It affects your bones. Your bones develop holes, so they become very weak, very brittle. So you can suffer breaks and things like that. But then obviously it gets in your blood, and yeah, quite serious.
Now, in those early days, did you anticipate what was to come? I guess you couldn't have known what was going to happen later.
You're full of questions right from the start, because what you're trying to do is you're still in the real world. You're still a working person. You've still got children, and your mind's it's going from your normal life to having to go to hospital, and so I was full of questions, and maybe not asking the correct questions, because all I wanted to do was I did ask, am I going to live? And obviously, well, you won't live if we don't do the treatment. But at that stage, when I first went into the hospital, over like 2 or 3 days, they did say to me I'd only got 6 months to live. And I got another panic attack then. So they got my breathing under control again. But obviously it was a shock. I stopped in hospital for 5 days, the first 5 days. Crying. Yeah, crying a lot. And I remember after the first day, my wife had gone. She stopped as long as she could, but she had to get back to sort the children out of school and things. And then the next morning she came to see me, and as soon as she walked through the door, I cried again. Because I was on my own all night, really. The nurse popped in every so often, but 80% of the time you're on your own. And what do? You think a lot. What's going to happen, and what about my children, and what about my wife? All those things go through your mind. So she walked through the door in the morning, and I started crying straight away. I had another panic attack, and anyway, the doctors came round, and Kath asked certain questions, what's going to happen, and how long is he going to be in hospital. And the doctor, his name's Dr. Hutchinson, he's retired now, absolutely brilliant guy. He just says, we can't say anything yet to you both because we need to do certain tests. So, you know, we're not being vague or anything, it's just that we need to understand exactly how severe it is. So anyway, she left, and she went, because a friend came with her for support. She walked out into the corridor, and I heard her cry. And what the crying was like, I don't know if you've ever seen these African people when they're at funerals and that, and they wail. You know, they're not like us. Well, and that's what she sounded like.
I mean, it obviously is a condition where relatives can be hit very hard by the diagnosis, just the way patients can. And sometimes clinicians forget, you know, we should really be supporting the whole family, if possible, through this experience.
Well, I mean, the fact is, they're going through it themselves as well. It's as if they've got it, really. But the thing is with them, like with Kath, she's got to carry on bringing the children up and running the house and things like that. I mean, I was fortunate because of my sort of work, my stature in my job and things. I still carried on getting full pay. So the financial side actually didn't come into play. I know it does for a lot of people, but at that time that wasn't an issue. It was just the fact that Kath, she was getting the boys off to school and then coming straight in to see me, then going back and picking the children up from school. They do go through a lot. And you can be a bit selfish, really, yourself, because I mean, yeah, you do. You feel sorry for yourself, and you tend to forget your partner a bit, really.
In a way, in that early stage, there's a kind of a change in role where you're the one that's kind of being looked after. You've got an illness, and you're the one at the centre of a lot of medical and other support.
Well, what I found was difficult because of my my work role, because I was a chief civil engineer. I had a lot of responsibilities, a lot of people who were working for me, and I made an awful lot of decisions all the time. But suddenly those decisions were taken out of my hands. Other people were now making decisions for me. And that's quite a difficult thing to accept.
I totally agree with that. That's a situation where you feel a lack of control, isn't it? Did you ever get that back in any way with your illness? Were you ever able to say, you know, I'm getting back in control of what's happening to my treatment?
Not really. Not in the early part of it, because you don't know anything. You don't know. I mean, I'll give you an example, if I can. The first thing I had to have is a CT scan, but one of the tunnel ones. And I was thinking before, when I got told I got cancer and that means I could die. Anyway, I goes in this CT scan, and you have to go in all the way in, and they pre-warn you. They say, look, it's going to be noisy. It clicks and makes all kinds of weird noises. We'll put some headphones on and play some music. I goes in there. My wife was standing out. I goes in, and I thought I was in a coffin. And I panicked, and I can't do it. Get me out, get me out, get me out. So they pulled me out, and I can't do it, I can't do it. And I was saying it to my wife, I can't do it, I can't do it. And my wife's really good at reassuring me. And so all she said is, you've got to have it done, Kevin. You need to do it. And this is what happened, this is the truth, right? I said I'll only have it done if I can feel you holding me. So we decided that, because your feet's slightly hanging out, she would hold my foot and gently rub it. And that was like a big reassurance to me. And I went in. I'm not saying it was comfortable, because it wasn't. I was glad when it was all over, but that helped me cope with that.
Yeah, that's a fantastic idea. I've never heard that one put in that way before.
Yeah.
You know, going into that tunnel of the scanner, whether it's CT or MRI, that's a huge stimulus for anxiety for anyone. And having, you know, gone through that, you can see how difficult it was, but giving that tip to people about that physical contact, that is really excellent, and I definitely take that on board.
Yeah.
So you had those investigations, and then...
Well, they confirmed everything, and from all the results of what they did, they then worked out the protocol for all the treatment, you know, the type of chemotherapy and the mixture of all the chemicals, whatever it is. So then the next part of that was, they said, we need to fit an Hickman line. Obviously, I've got a clue what an Hickman line was. So I said, well, what's an Hickman line? Well, we need to put a tube into your chest, and it's got two out pipes, and one is for taking bloods, and the other is for putting something into it, if we need to put anything into it, yeah. Oh, right, okay. So it's automatically you think, oh God, it's a major operation, when it actually isn't. You know, it wasn't a big operation. All they do is numb the area, and before you know where you are, the Hickman line's in. But again, you don't have any control over it. You've got to have it done. Well, you do have. You could give up, I suppose, but it was important for me. Well, simple to see my children grow up. Anything
you say to yourself, like psychologically, when you're facing a difficult procedure. You really don't want it, but you think I've got to have it.
Believe it or not, there's me at that time with all this responsibility with my job, not forgetting my family, but with all the responsibility of quite an important job. People could get killed on the railway if it's not maintained correctly and that. So there's a massive big pressure on you. I could cope with that, but I couldn't cope with things like they were going to, like just having an Hitman line put in. I found I was scared stiff. Again, I had a panic attack.
Were you ever in the position in your job where you were told to do something by, a senior manager or something that you didn't want to do?
I'd never do that. I would never do that because I knew what the rules and regulations were with the safety, and I would never jeopardise the safety of a passenger.
No. But the reason I ask that is because you might feel that is a parallel to being unwell and asked to undergo a procedure which you really don't want. You know it's going to be good for you in the end, but it could be painful, or it could be the fear of the unknown, a complication. There's many reasons you might not want it, and it's almost like a health and safety issue for yourself.
Okay. I'll tell you what I found was a problem in terms of the medical side of things. Was they told me I had to have a bone marrow test. So what's a bone marrow test? So they explained it to me. They have to put a needle in through your buttock and then into your bone, and they have to take out a sample. And my first question was, does it hurt? And well, just a little bit. Well, that's not true. It did hurt, and it hurt a lot. And when it was, I knew it had to be done, but after it, when it was done, I turned round to the nurse and I said, why didn't you tell me how painful it would be? Because then I didn't want another one.
What did they say to that?
Well, I suppose they don't tell you how painful it is because you won't have it done.
That could be true.
So that's why they don't say it.
Yeah, but you prefer an honest approach, I think, prior. You'd prefer to know the real facts.
Well, okay. I did have to have another one. Well, in fact, I had two others, but the next one, because I knew how painful it was, I said to the nurse, it's amazing when you attend hospitals a lot and you attend the same wards and that, you get to know the nurses really well. In my case, because always in my work environment, I've always called people by their first names because I think it's respectful. And then when it comes to the nurse, I did ask the nurses, I don't want to keep saying nurse to you. Can I call you by your first name? And they haven't got a problem with that. So you get used to your nurse. Anyway, this nurse, he said, you've got to have this test, another bone marrow test. And I said, look, can I take anything to calm me down before I have it done? And they did. They gave me some kind of sedative in a tablet form. And I was okay. But I really do believe that they should really tell you the truth, really. Because it would put you off. There's a lot of people, I know some people that I knew, I'm not having one of those again.
Did you ever refuse
Yes.
a test or a
Yes, I
treatment
did.
that you really wouldn't come round to being persuaded to have?
Yes, I did. I ended up having it, but what happened was, can I step back a bit? I started on the chemo, and the chemo treatment was in a what we call a pump. It's a round thing on a belt, and you put it round your waist, and they attach it to your Hitman line, and you have it over 7 days. It slowly goes into your body. And I think it was about five goes with it. And they told me what happens is, the multiple myeloma will stop growing, but will reduce down to what they call a plateau. It will just drift along at the same level, but after a while, and they can't really give a time span for that because it depends on your body mass and how fit you are and everything else, it will start creeping up again. So anyway, I went through most of that, and then Dr. Hutchinson said, we'd like to do a bone marrow transplant on you. You need to have a bone marrow transplant because it's the only way you're going to survive. So we need to do bone marrow tests on all your siblings, which they did. Everyone said yes, and this is exactly what happened. I got an infection, which you tend to get infections when you have chemotherapy because it reduces your immune system down. So you're prone to getting quite severe colds and things like that. So they get you into hospital and you get temperatures. So they get you in and put you on antibiotic drips because it's the quickest way to clear it up. So I had this particular bug, and I went in, and you know, in hospitals, you've got your own folder. That's your folder. It's all about you, with all your results, your blood results, and everything. And it's at the end of the bed. It was at the end of the bed in my case. And this particular day, my aunt came up from Cornwall, called Auntie Val, a pure Cornish woman. She came up, anyway, she came to see me with my wife, and all the bone marrow tests had been done weeks before, and we're sitting there, well, I'm in the bed and they're sitting on their seat, and Dr. Hutchinson's deputy, Dr. Hunter, another nice person, came in and she said, "Do you know the results of the bone marrow tests?" I said, "No." "Are you not been told?" "No." And she went to this folder at the bottom of the bed that's been sitting there for days and days, and she opens it up and she says, "You've got a perfect match in your twin sister." Right. My wife, my wife and my aunt started to cry. I just sat there. I didn't realise what it all meant, to be honest. Dr. Hunter went out, and my wife and my aunt said, "That's good news, Kevin. That's really good news." And I still hadn't clicked really what it all meant. Till about half an hour later, my wife said, "You know, that's a chance of life, Kevin." And then that's when I realised, oh, probably is. But then you're thinking, what's a bone marrow transplant mean? What's that going to be like? Well, before you have a transplant, you have to have radiation treatment. In my case, I had to have full body radiation. So they geared everything up. You have to have also tattoos put on your body in certain areas. So I had that done first, all in the Royal, and then they took my weight, all kinds of different body mass measurements. It was all geared up for, I think it was about April the 4th. I can't remember which year it is now, but April the 4th. And they said to me, you've got to have your radiation treatment before you can have your transplant. Radiation treatment literally kills all your cells in your body. But it's a very dangerous position they put you in when you've got no cells as such, because if you get a very small cold bug, it can kill you. But anyway, what happened was I had to go down in the Osborne building, down in the radio treatment centre thing, suite, and see the consultant there. And he said, we want you to sign this consent form, but I have to tell you all the side effects. So there's me sitting there, my wife sitting there. Now at this stage, at this point, I was allowed to go home, you know. So it was sort of 5:30 in the evening, I'll always remember. And obviously winter time, April, so it was fairly dark outside. And I was sitting there and he's reading all the side effects. And he just went on and went on and went on and went on. And I thought, my God. My God. And he gave me the pen and I was shaking. And I just said, I can't sign it. I can't sign it. I was scared. Absolutely petrified. And my wife turned around. My wife turned round and asked the doctor to leave, and she turned round and she was really blunt with me. She said, don't be such a selfish person, Kevin. And she'd never been like that before. Don't be so selfish. And I was sort of mad, really, for her to take that attitude towards me. I said, what do you mean? I'm not selfish. I'm blooming scared. Don't be so selfish, Kevin, because it's not just you. It's me. It's Ben and Joe. What are we going to do if you're not around? And again, this reassuring thing from Kath made me double take and double think, and I signed it.
Now you raised something interesting right there to me, which is about how much do we correctly explain very complicated procedures in terms of side effects. Sometimes we can overwhelm somebody by listing them all almost randomly, rather than making them meaningful for somebody. But even more than that, if I can just say, it's that we don't necessarily support people when we expect them to go through something difficult. We may rely on the fact they've got family and friends around, but that's not always the case. So in a way, you were put in a very difficult position there, I think, looking back on it.
Well, I think, I mean, I can only say it from my point of view. Obviously, we're all different. We're all individuals. But all I can say, I mean, I'm very clinical with everything I do because of my role in my work and everything. I have to be precise, so I understand why you have to say certain things. But when you're actually dealing with your feelings, that's a different thing. Now, what I would have liked is the consultant to turn around and said, look, there are possibly quite a few side effects. And what I would have liked him to have said, these are the ones that we know will happen rather than could happen, if you understand what I mean.
Yeah, that's exactly what I was trying to say.
And one of the things was, because you can get cataracts. Oh no, you do get cataracts. So, you know, that's fair enough. It will develop into cataracts, but obviously we can sort cataracts out. Things like that. Rather than what, you know, like you've just said, so, you know, some of the clinical, medical sort of terminology, it's too much for your brain to cope with.
Now let's take an overview of all of your pathway through the myeloma, the diagnosis, the treatment, and the recovery period. How do you feel overall it was handled by the medical profession and nursing profession?
I could answer it in two ways. The first answer is they saved my life. What more can I say? I never had a problem with any of the nurses or doctors. You know, you get used to, as I said before, to the doctors and to your consultants. They know you, they get to know you. You know, they know basically when you're going to cry. The nurses, they know how to cope with that side of things. Right, okay, right from the start, suddenly I was on a roller coaster. And it just went on and went on and went on. Now and again, I wanted, just for the roller coaster, to stop at a station so I could get off and just get a bit of my life back, but I knew I had to get back on it. That's what I think for me was needed, just to be able to step away from it so you could just deal with certain things, even down to your family life a bit of normality, and then get back on the roller coaster to the next bit.
That's a really amazing analogy. I really like that one. Did you feel that was achieved at any time where you had those breaks?
Not really. It just seemed so, everything was happening so fast.
Did there come a point, let's go forward in time, where you felt finally things were looking up and you were regaining your stability?
Okay, I'm going to say it in a terminology that I know, and it's to do with the railway. Okay. I found out about the cancer, and I was going into a dark tunnel, and I couldn't see the end of the tunnel, and it just went on and went on. No, sorry, there was a small little light right at the end, and I could never seem to get any closer to it. But as the treatment went on, and especially when I had the bone marrow transplant. Now, the bone marrow transplant is quite a crucial part of my story, really, because what happened was, at the Royal, there were 5 rooms, individual rooms, for 5 patients. When you've had your radiotherapy, and then you have your chemotherapy. Now, at the point when you have your chemotherapy, you have severe chemo, where you lose all your hair and everything. But before you start that bit, all the patients, there's a kitchen, you all mix together and you talk about the different cancers and things, where you live, your family and that. Then suddenly, it's your time to go into isolation because you're going to have your new bone marrow. And you go in, so the door's shut. Your wife can come in and that with all the gowns on, but your children aren't allowed to come in because in schools, they have loads of bugs. So they wouldn't let your children. Now that was one of the hardest bits for me, was the last time my son saw me, I had all my hair and everything. My wife brought them up and all they could do was look through the window. And my son said, "Who's that?" When it was me.
How old was he at the time?
14. And I wanted to cuddle them because I was going to start my serious treatment then. I wanted just to cuddle them, just in case.
Yeah.
And
it sounds like to me a rather almost cruel situation where you're detached from them. They're looking at you as the person unwell.
They can only remember what you used to be like. Because I was always a dad who'd always get involved with them. take them football or whatever, go Bradgate Park or wherever they wanted to go. Suddenly, there's this guy in this bed. I'd lost weight as well, with no hair, and they just didn't recognise me. And it was very odd, because also I didn't think I was going to see them again, which is very, very difficult. I didn't cry. I cried when they went.
Definitely. I can totally understand that.
But yeah, that's hard. But then I carried on, and you still have blips now and again. You know, something, I mean, you see, I always like to keep myself clean and tidy. I have self-dignity and everything else. But suddenly you know, you've got diarrhea because of what you're taking, and the nurses have to clean you up, and you can't, well, you don't get any air anyway, but that's difficult. But you have to get over it. I used to just used to, because I saw some children with cancer, and, you know, only 5-year-olds, 6-year-olds. And I used to think to myself, at least I've lived 40 years. And that's how I used to get myself over it, when I felt really low. But then what happened was, and I did, okay, the other thing was I didn't understand what the transplant was going to be. I didn't, because I wasn't really given much information as to what they were going to do. You know, a bone marrow transplant, wow, you think it's going to be a massive big thing. But they said, oh, we're going to do it tomorrow, Kevin, about 11 o'clock. And so the following day, my wife came, in fact my elder sister came as well, and this nurse came in, and she's got a big syringe, and it was full of reddish pink blood, bone marrow, whatever it was. And all she did was put it into the Hitman line and slowly put it in. Took about 10 minutes. And that was the bone marrow transplant. Now, as she was putting it in, I was thinking, that could save my life. You know, that could save my life. So she did that, and a bit of an anticlimax, really, because it was all done in 10 minutes. But then, from that stage, you do get very poorly then, because your body's trying to, in fact, it's like a boxing match going on in your body. Your body's trying to throw it out, and the new bone marrow is like an army trying to invade it, so it's quite difficult, not easy. But I got over it, and I kept saying to my wife, how's such and such doing, and how's, oh, yeah, they're okay. And anyway, it came to the day that I was going to be allowed out, which was about 16 days later. I was going to be allowed out the room. And before I went out the room, my wife said, oh, I've got something to tell you, Kevin. Because I'd noticed loads of people over the 16 days walking around and things. And I've got something to tell you, Kevin. And I said, what's that? The other 4 guys had all died while I was in there. And then I was really sad, obviously. But I also thought, I'm a lucky devil. So that's when it started to be a bit more positive. And then going through, still this tunnel thing, travelling through this tunnel. And the light at the end of the tunnel was getting closer and bigger and bigger. And then I remember going home and pulling on my drive. The place I loved, the place I loved to live with my family. Pulling up on the drive and thinking, I've made it. Well, I made it through that bit anyway. And I remember leaving that drive to go for the bone marrow and looking back and thinking, am I ever going to see this place again?
Coming back was symbolic of a big step for you, getting back out of hospital and getting on that road to recovery.
Yeah, I mean, yeah, you don't know, obviously you don't know what's going to happen, but yeah, just to see your children, to be in your lounge again and
to do those normal everyday things was then a pleasure, of course.
It was just good to have your boy sitting next to you. That sort of thing. Sleep in your own bed.
Was there anything you were then able to do that was really remarkable for you? You thought, yeah, I am getting back to the old me, you know, it's not all lost.
Okay, I'll tell you what happened. I was very weak. I lost a lot of weight whilst I was having all the treatment, so I was very weak. And it took me a lot just to walk around. And I ended up just getting up and just sitting on the settee, or laying on the settee, feeling really sorry for myself. My wife carried on with the normal daily things, and I ended up watching TV. I deemed myself to be a fairly intelligent guy, but I ended up watching daytime television, and it's not good for you, you know. I was watching what was Jerry Springer, and it was one of these weird things where my husband's gone off with my sister's second brother's type storyline. And I was sitting there and I was thinking, this is crazy, Kevin. What are you doing? Just sitting here watching that? So I got the remote and switched the remote off. And then I walked around the house to see what needed doing. And from that day, I changed. It was hard work doing simple tasks, but I made sure I did them. Now, we were coming into the summer time then, so the weather was brilliant and that. So I even went in the garden and did a bit of gardening. Again, it wasn't easy, it was hard work. But I used to do a bit, have a rest, do a bit, have a rest. But I started to feel normal. I really did. Yeah.
And that's a very important step there, which is to get back to doing as many non-ill health related things, as many normal things as you can. I know they feel like big steps initially, but to do it gradually and pick up one. My biggest goal in terms of proving something to myself, like an achievement, was I lived in a cul-de-sac and I wanted to get out from the cul-de-sac and walk right to the top of the road. It was probably about 300 yards, and turn round and come back again. Now at the top of the road there was a bench, and I wanted to walk up to the bench, be able to sit down, which was a massive task, and then obviously come back. But the good thing, halfway up there's a pub. Right. Now I wanted to have a drink as well. So anyway, the first thing I did was walk to the top of the drive. I walked down, I had quite a long drive. And then walked to the end of the road. This was over 2 weeks really. And then walked to the top of the road. I didn't, you know, to where the bench was. I didn't call in the pub on the way, by the way, you know. But I did call in the pub on the way back. And I had half a pint of bitter. It was pure nectar, that half a pint of bitter. It made everything worthwhile. In a way, that was a reward for doing that walk, wasn't it? It kept you, it was something to look forward to as part of the walk.
Yeah.
It was an incentive. So you set yourself a target and you had an incentive.
Well, it was good to be able to walk to the top of the road, to be honest.
Definitely. definitely.
You know, that meant my friend actually came down from Newcastle. He stopped over with his wife for the weekend, and he's always been a walker. And I was about to give up 3/4 of the way up, but he encouraged me to the end.
Now let's have a think. How you're doing at the moment, and looking towards the future. What do you think the future holds for you?
Well, it's been a bit rocky since the transplant. There's been various side effects that have occurred. Cataracts. I had to have cataracts operation. Then I have something called graft versus host disease, which is your body still fighting with a new bone marrow. The doctors still like to see that happening because it shows that your body's active, but it can actually go out of control. So you have certain treatment to try and control it. Now, in my case, it's affected my skin, it's affected my nails. I've lost my leg. So I'm having to cope with that, but again, I've got a new leg that I'm practicing with. I'm doing fairly well with it. I have an automatic car now, so I'm managing to travel around, catch up with loads of my friends. Unfortunately, my marriage broke up 4 years ago, down to all the pressures. In fact, my wife turned around and she says, "I love you, Kevin, but I don't love you the same. I became your carer." Which I could understand all that, and she went through no end of pressures. So anyway, I now have a new partner. She's called Caroline. She lives in my village. We have a really good relationship, and I was sort of still doing some technical work for the railway, but I think I'm going to pack in now completely, because I don't really need to work. That's the truth. So I think I'm going to pack in work, but I'm looking now to the future. I know I got a bit upset through what I've been saying, but that's going to happen. But I've got a smile on my face now. I can laugh, I can joke. I love socialising with people. I'm a talker, probably can tell that. But yeah, I'm looking, I mean, who knows what's around the corner? It's not really worth thinking about it, really. You've got to take each day as it comes and make the most of every day. And that's what I try to do.
Well, Kevin, thanks for coming in today and sharing everything you've learned about myeloma and also about how to get back into life after the myeloma with us. And I'm sure people watching the video will really appreciate you going through what has been quite a difficult time in various stages, hasn't it, for you? But it's nice to hear that at the end you're looking positive and you're looking...
Well, all I can say is, I mean, the bone marrow transplant was 15 years ago. I've lived an extra 15 years. I've seen my sons grow up to be men. And I can't tell you what that's like.
And what did they say to you on those early stages of your prognosis, the outlook? How long? Right,
okay. It wasn't what they said to me. It was what other people said to them at school. Mm. When you're in a village, news gets around quick.
What did they say?
And they were told by other children, your dad's got cancer and he's going to die.
Yeah. And here we are all this time later. You've done well and you're doing well.
Yeah. And let me just end on this really positive note. My youngest son, Joe, he's 21. He's had a few problems, but he's now gone into the army. He's doing all his training. And I went to see him on his passing out parade only 2 weeks ago, in his uniform and everything. And he hadn't seen me with my false leg on. I made a deliberate point of going with my false leg so he could see me standing there to shake his hand, well no, to cuddle him. I can't tell you how proud that made me.
That's really good. Really, really positive note, as you say.
Yeah. So I got there.
You certainly did.
Okay.
All the best.
Thank you. It's been my pleasure.
Thank you very much.